Hello and welcome to today's OET speaking practice. In this video, we'll go through a sample roleplay for the OET speaking exam. I'll show you how to structure your responses, use key phrases, and communicate effectively as a healthcare professional. Hello, good morning.
Good morning, doctor.
I am Dr. Sarah, one of the doctors working in this clinic. May I confirm your name and age, please?
My name is John and I am 63 years old.
Nice to meet you, John. How can I help you today?
Doctor, I'm not one to usually bother doctors, but I just thought I should check in. You see, 6 days ago, I was gardening, and I stepped on a rusty nail. It went through my sandal, and slightly penetrated my foot.
Oh, I see. Have you cleaned the wound?
Yes, doctor, I cleaned the wound and put a sterile dressing on it. But yesterday I read an article about people over 50 getting tetanus from things like garden injuries. So now, I'm a bit worried.
It's good that you're here, and I completely understand your concern. Let's address this step by step. Have you noticed any symptoms like muscle stiffness or spasms, especially around your jaw or neck?
No, nothing like that. There's just a little tenderness around the wound, but no stiffness or spasms.
That's reassuring.
Doctor, is tetanus really serious disease?
Yes, John. Tetanus is quite serious because it affects the nervous system and can cause painful muscle spasms, difficulty swallowing, and even breathing problems. Tetanus usually causes symptoms like muscle stiffness, especially in the jaw, often called lockjaw. These symptoms tend to appear between 4 and 21 days after the injury.
And what about vaccination? I had one when I was a child.
Vaccine is very effective for the prevention of tetanus, but the protection from childhood vaccinations doesn't last a lifetime. You need a booster dose every 10 years to maintain immunity.
Oh, it's been much longer than 10 years since my last tetanus shot. Should I get a vaccination now?
Yes, I would recommend getting a tetanus booster today since it's been more than 10 years. This will help protect you, especially considering the nature of the injury and your age, as the immune system may not work as well as it used to. Better to be safe, and we can administer the booster here today.
That sounds like a good idea. Is it still safe for me to keep gardening at my age?
Absolutely. Gardening is great exercise, and it's wonderful that you enjoy being outdoors. I would just advise you to wear sturdy footwear with thick soles to avoid any future injuries. You can also wear gloves and make sure you clean any cuts or wounds promptly, just like you did this time.
Thank you, doctor. I'll definitely be more careful in the future.
That's nice, John. Do you have any other question?
No, doctor, thank you.
You're welcome. I'll get everything ready for your tetanus booster now. If you have any more concerns, don't hesitate to come back.
Okay, doctor.